We have somebody who's really a prime mover in the White House on many of the things that we've been discussing today. We're going to talk about chronic disease and American health. Let me invite to the stage Calley Means, Senior Advisor on Healthcare in the White House. Hey, my friend, good to see you. Thank you so much. Good to see you. Thank you.
Great to see you.
Thank you. I don't know if you've caught any of it. We've been going at this. It's been a bit of a marathon.
You have 28 interviews.
Kind of. I just decided, why not educate myself? Why give that privilege to someone, I don't know, at Axios or something, and just bring this thing along? Because I'm finding it, I'm learning, little bits of the health ecosystem, and there's some really brave people out there trying to change the game, and I think that's in part what you're doing. And I think, let me just start out. I mean, a lot of what you're doing is advising how to make MAHA real, how to make America healthy again real in a sense. What are the component pieces that you think are most important to elevate in that campaign?
Yeah, I'll never forget Bobby Kennedy walking out for the first time in a surprise announcement on the stage with President Trump. And President Trump later says one of the loudest cheers he's ever heard, and it was electric. And I think one of the things we're doing, and we can't do enough, is just articulating the central thesis again and again and again that resonated with voters. And that essentially, to me, is that in our 250th year, we do have a lot to be proud of with American healthcare innovation. But we also have a lot to not be happy about, especially in the past 40 years. Foundationally, what we have seen is a disaster. We have the highest rates today, this year, of diabetes, obesity, cancer, pediatric cancer, autoimmune conditions. You go down the list, highest rates of those conditions of any society in the history of human civilization, particularly among kids. Now 38% of teens have prediabetes. 20% of young adults have fatty liver disease. Those rates were close to zero 2 generations ago. They're close to zero in other countries. This is a unique issue in America. And the foundational problem there is not what's being talked about a lot today, which is what Bobby Kennedy and I call shuffling deck chairs in the Titanic, with the insurance industry, the pharmaceutical industry, and doctors pointing fingers at each other on marginal changes. That is gaslighting, and it is bullshit. What we have foundationally is a problem where the largest industries in the country have a business model that's predicated on people being sick. And this is good companies, there's good companies, good people in these industries, and they save lives and they do a lot of good things. But I think most can acknowledge that the business models in this room and the business models in American healthcare lose money when hospital beds are empty, make money when they're full, lose money when there's less sick patients, lose money when really healthcare costs go down. And that question, for the first time, is being highlighted at the highest level of American politics. And it's leading to a lot of interesting conversations. Number one, on healthcare policy and how to really transform it. But number two, the root causes. And I can tell you, at the White House, it's stark to me. Nobody has talked about ultra-processed food at senior level meetings. Nobody has talked about toxins. Nobody has talked about the root causes of what's fueling this crisis. 90% of healthcare costs are chronic diseases that are essentially preventable and reversible in many cases. And the fact that this administration is putting a line in the sand on ultra-processed food is opening up these complex conversations on environmental toxins in a much more pronounced way than any administration in history. And then grappling with these questions, and I'm meeting with leaders of the healthcare industry every day. We are not pointing fingers. There has been rules of the game for the past couple of decades, but every single industry we meet with acknowledges these rules are broken and we need foundational change. And we're building a 10-year bridge of where the foundation of the healthcare system has to be making money and predicated on Americans being healthy, and it is not today. That thesis that's been injected into the conversation that's being talked about here, that's the great accomplishment of the Trump administration, right?
So the processed foods question has been percolating out there on the sidelines of the health debate for a long time, but not mainstream in a way in which you've done it. And so, and I think that what I've begun to see and I don't have the data, you're gonna know the data more. I have been interested in this, GLP-1, obesity drugs, et cetera, not just on wait lists, but on changing the buying habits of Americans with food. And so this result that the Safeways, the Krogers, or others are reporting, wow, fewer people are buying processed foods, more people are buying, fruits, vegetables, and proteins, and they're having to change their stocking. To me, that's empirically important because it shows that there's something going on with people and how they're interacting with their health. Because all I've heard on the process is preaching before, but that didn't really change behavior. So the question is, are there partnerships in some of these drugs? I've talked to Dr. Oz about this, and he thinks there are possibilities, but does that kind of help you along the way of talking about health in a different way?
It's really notable that this conversation, a lot of people bring up Michelle Obama, that this conversation has been energized by President Trump, by the right on ultra-processed food. There's a moment for it right now. A couple of years ago, when my sister and I got really passionate about this, I really became passionate about going on Fox News and talking about this to the right. And I think this is what's happened, and we're at this.
And this is your book, Good Energy.
Good Energy, and we really
Good Energy: The Surprising Connection Between Metabolism and Limitless Health.
The foundational stats and thesis on this is that, I'm a conservative. I believe in personal responsibility. But Harvard just reported it's actually not 70%. It's almost 80% of Americans are overweight or obese. 50% of teens are overweight or obese. 60% of adults are pre-diabetic. When we have these type of statistics, it's not as much of a personal responsibility issue anymore. We really have systemic problems. And then you look at other countries. A child's diet in America is 70% ultra-processed food. In Spain and Italy, it's 10%. So there's something systemic happening. And it's really two things. We think it's co-option of our medical advice. So until the Trump administration, until this past year, the US government, the official guidance to the medical communities and to government procurement was that ultra-processed food was as healthy as whole food. That they did not raise an alarm on sugar, they did not raise an alarm on highly refined carbohydrates, they did not raise an alarm on this. And I can tell you, having helped drive these dietary guidelines, that was because of special interests. That was because people came in and said, you need to recommend Doritos as a healthy snack for children in schools, which it is today. You need to recommend and not go hard after sugar drinks because of our bottom line. And that argument won out. People that did the Biden administration dietary guidelines said that they wanted to obviously call out ultra-processed food when we have a diabetes and obesity crisis. They couldn't do it. We got that done. That is a big deal. And the fact that the US government now, for the first time, under the Trump administration, for the first time, is saying that it is a public health crisis that we have such a preponderance of ultra-processed food, it's a big deal. That conversation, which has been fueled, I think Bobby Kennedy and President Trump took advantage of, but also helped fuel, is leading to dramatic changes in American culture. Last year, the American Grocers Association reported that whole food purchases went up 10%, the largest increase in history. It's usually just a couple basis points, and ultra-processed food went down. So Americans are waking up. You talk to somebody, whether they're a Trump supporter or not a Trump supporter, people are reading labels. There's statistics on this. They are thinking much more about what's in their child's food. So that's a very, very good thing. The other issue that I think we've had is that the medical industry, I do not think medical CEOs, insurance, pharma, et cetera, they are not sitting around over the past 40 years and conspiring on how to, get kids sick with ultra-processed food, which has driven trillions and trillions of dollars to their bottom line. I mean, it's $5 trillion a year. 90% chronic disease, predominantly tied to ultra-processed food. I mean, it's been the greatest economic growth engine, people eating ultra-processed food for the largest industry in the country, healthcare, ever created. That hasn't been a conspiracy. People aren't trying to do that. But the medical industry has turned a blind eye, I believe, in the past couple decades to what's happening in our American diet.
So everything you're saying, Calley, I can get my head around. There's a logic to it. You can understand it. And what you're arguing is, to some degree, our political system has corrupted, some of the levers in this and created a systemic challenge, or the implications of it are that. My question is, I ask in a friendly way. I think people can come along that way. How far do you go? Because I think one of the controversial things in the administration is stance on vaccines, stance on flavored vapes. I mean, how do you kind of move in this space in a way that, how do I put it, that's harm reducing, smart, yet science-based? Because I think some of the vaccine stuff's been a little bit rocky. But how do you make the progress you want to make and get people to trust you when you've got a kind of portfolio that's controversial?
What's been encouraging about the ultra-processed food agenda is I talk regularly to the American Academy of Pediatrics, to the American Medical Association, to the American Heart Association. The American Medical Association president was standing on the stage in the West Wing when we announced the dietary guidelines. The American Academy of Pediatrics is in litigation, major litigation with the administration on other issues. So on the ultra-processed food agenda, the administration from the top has taken a stance. We want all comers and want to partner with everyone, including a lot of people in the healthcare industry. I mean, again, everyone wants this to improve. Our strategy has been threefold. So we've had a lot of success with looking at where government spends money. So this market dynamic of the preponderance of ultra-processed food,
Yeah.
You look at the government, it spends hundreds of billions of dollars a year on food procurement. I mean, SNAP is the third to fourth, depending on year, largest entitlement program in the country. It's $120 billion. 15% of Americans depend on that for food. It dramatically impacts, it's a worldwide agriculture and food distortion, how much money goes into that program. Number one item.
For processed foods.
Number one item on SNAP is sugary drinks. Number one item, the supplemental nutrition program. Number three item is potato chips. Number four item is candy. It's criminal. So while Congress, there's a bill, has very few co-sponsors to do the obvious no-brainer thing of taking soda and candy off SNAP, almost 30 states have submitted waivers based on the MAHA momentum, and the USDA has approved them. So 30 states in just 1 year almost have taken soda and candy off of SNAP. This has dramatically impacted food markets. Pepsi recently announced that they, in response to this partly, have reduced prices 15%. A big thing we have coming up is school lunches and military food. I mean, school lunches, that's 45 million meals a day for kids. The number one item on school lunches right now, for breakfast, is sugary pastries.
What?
Sugary pastries, donuts. Sugary pastries is what your tax dollars are funding every single day, tens of millions of donuts and sugary pastries to destroy the metabolic health of our children in the morning every single day and set their palates up for a lifetime of addiction to sugary food and highly refined carbohydrates. We are taking a sledgehammer to school lunches. And from a science-based opinion, if the US government is going to spend money on food, it should not be going to food that almost guarantees kids for a life of obesity and prediabetes. So that's coming out. We've had a lot of success with government procurement. Real quickly, number two is.
But I just want to say this is something that should have bipartisan support. I mean, I've heard.
Well, we've had blue states submit waivers.
This is what Bloomberg was trying to do. There was a lot of things.
Yeah, I mean, Democratic senators who my sister and I were very close with before the election told us behind closed doors to our face that their life's work is getting what we've gotten done. What we've gotten done on school lunches, the dietary guidelines, GRAS reform, what's happening has already been seen with some of the food diets and other commitments. These are the top things that advocates on both sides of the aisles have been fighting and saying was almost impossible for decades. It's happened in a year. And these Democratic senators have told me to my face that they want to help but will not give President Trump a win. They've said that to my face. So that's the situation with Democrats.
So the states are the action agents.
States are moving, and there's been bipartisan action. Number two, so government procurement. Number two is, I think this is the most important thing, and it's going to have a huge impact on the history of America, I think, in health, is we've told the truth. We have told the truth for the first time. And that goes to, for the first time in history, saying ultra-processed food is something that should be avoided and highly refined carbohydrates are something to be avoided. And sugar, added sugar, is something you should think about. The government dietary guidelines until the Trump administration did not take a hard stance on added sugar. It's crazy. We have done that, said the truth, and that flows into the procurement and other medical issues. We've also used that to work with hospitals. CMS did a rule where hospital food is an embarrassment, it's a joke. And now CMS payments are tied to hospital food, and hospitals, to their credit, have been stepping up and are dramatically, you go to any hospital, they're talking about the food and dramatically improving food. Number three is we've taken a significant, and this has been very collaborative with top universities, with major medical associations. They want to study this. They want to study why we have the highest rates of heart disease, diabetes, obesity. So we're fueling a lot of money thinking about food and root cause interventions as a clinical reality. We think what Lilly's doing and a lot of these drugs, frankly, GLP-1s have been critical in the past, but if they don't have massive side effects and they can help people get on the train, I do think that's a more preventative, more root cause situation. Fine. We really encourage innovation from the pharmaceutical industry.
If you're hitting it from both sides, you're going to.
But you've got to, and Lilly would agree with this. You've got to study food as a clinical intervention. So we're doing a ton of research on that. It's a top priority of Jay Bhattacharya. And if somebody's diabetic or severely obese, GLP-1s might be part of the situation, but the doctor taking their blood test, thinking about their insulin resistance, giving them personalized recommendations on food and potentially on the way to that being part of the medical system, that's obviously part of it.
I know this is an unfair question, but I'm sure in some ways you've gamed and simulated this out, and your knowledge of it is much deeper than mine. But as you're hitting generations of kids and changing the school profile, you're trying to get some broad public embrace of this because of the information you're putting out there and getting people, for those who can change their diet and approach doing so, and then supplemented. I'm just interested in what our expectation should be in terms of seeing the net benefits to American healthcare. How fast or slow is that ship? Can it turn?
This is a nasty town, tough town, and this all is in a political prism, which of course we know. We are unbelievably optimistic. I think we all see it. There is parents here. There is a revolution happening right now in Americans thinking about their food and thinking about their health. The degree of people going outside the medical system trying to get control of their own data, understand, optimize. This genie is out of the bottle. What my prediction is that in 10 years, we are going to have headlines that healthcare costs are shockingly low. How did this happen? We are going to see, and we're already seeing actually, decreases in some of these core metabolic conditions this past year for the first time. We are going to see a plummeting of obesity, diabetes, heart disease rates. It's very simple. As Americans become more awake, shift more of their diet to real food, it's the greatest budgetary solve we can have. It's the greatest solve for American health. It's the greatest solve for the American economy. We are decimating, really, with our healthcare system and our healthcare incentives, American human capital. 25% of women are on an SSRI right now. It's not good or bad, but that's demonstrable. There's a depression crisis. That's number 2 cause of death for a young adult right now is suicide. Somebody's diabetic, which many Americans are, obese, it really impacts their happiness and their life and their productivity. So this is already happening. You're seeing signs of it with the data on obesity and diabetes. We're seeing slight signs. This momentum is out of the box no matter what happens politically. And I think it's going to be a signature accomplishment of the Trump administration.
Calley, I hate to ask you because you're in the White House, you're like the mothership, but as you said, there are lots of different departments do different things, and I'm always interested as I do a lot in critical material space, and there's a lot of synthesis across different ways, but it's not all aligned. But is USDA on board?
But Brooke Rollins has been there's no USDA secretary that has said the things that she said. She has been all in on ultra-processed food. She has been all in on school lunches. She's all in on the dietary guidelines. She talks to Secretary Kennedy and me regularly. Almost every week / every day. We are texting like all the time. These are massively complex issues.
Sure.
These are massively complex. There's trillions and trillions of dollars of industry. We're talking about the food system, the healthcare system, the agriculture system.
Patterns,
and Brooke Rollins has absolutely dived into this. And the Trump administration, although the media likes to, just break their necks to find the pot shot, there's tremendous things happening. This administration, the first time the government at the highest levels has talked about regenerative agriculture, has talked about the need to think about our farms and how farming works. We've invested billions of dollars with ARPA-H and others into technologies that can more precision apply pesticides. We've opened the door for massive new investment in the next generation of crop protection tools. So Brooke, Bobby, throughout the government, I've been inspired by it. How everyone's rolling up their sleeves and trying to make lowering rates of chronic disease a hallmark accomplishment of the Trump administration. And I think that's going to happen. When all is said and done in a decade, 2 decades from now, we are going to see this point in American history as the time Americans woke up and really a propulsion of innovation. I think in the next 5 to 10 years, with these core things we're talking about, with things like pesticides, with things like our food system, with things like exercise and our movement, people are waking up to that. Technology is going to help. Americans waking up is going to help. And then again, what we've been trying to do is steer incentives to research, steer incentives to where the government's spending money. And importantly, on the healthcare system, the solve is just giving Americans more control of their health. It's not this crazy finger pointing between all the industries, which again is a joke. It's giving Americans what the president's healthcare plan is: control of their own money, giving them transparency. Hospitals refuse to even show the prices, and let them decide. Let them decide whether they want the GLP-1 or whether they want to invest in a more functional medicine type approach to get their blood tests. The Americans don't have that choice now. If you're on Medicaid right now and your child is depressed, they're getting an SSRI. If they are
pre-diabetic, they're getting a metformin. They're getting a statin if they have high cholesterol. That's what's happening right now in a 15-minute appointment. There's no choice in the medical system by design. So that's what the president's healthcare plan is, and we're pushing that really hard. I think that's the key solution.
I love spending time with you because I can just feel your energy and your passion and all that. It's part of this whole discussion, trying to, change the game, pick up the clutter, figure out how we begin pointing all of our assets and financial resources and, strengths in a different direction. And sometimes you got to swim upstream, which sounds like you're doing. So Calley Means, I want to say thank you so much for joining us.
Thank you for the opportunity.
Calley Means, Senior Advisor on all these great healthcare issues in the White House. Really appreciate you coming over. Thank you very much, Calley. Thank you.
Thank you.